Hi, this is Dr. Mary Kathleen Figueroa coming to you from my thyroid channel. I appreciate your tuning in. If this is your first time, please be aware that this is for educational and entertainment purposes only. If you have specific medical complaints, please discuss them with a local endocrinologist. So, what are 8 things that your naturopath may not have told you about Graves' disease? Number 1, the naturopath might not have told you that while 95% of Graves gets better on its own between an 18 and 24-month period, Graves is forever. You cannot overcome Graves because the antibodies to your thyroid, that butterfly-shaped organ that is right on your neck, right down here near your collarbone, is forever. If your immune system has decided that your thyroid is foreign, it will always think your thyroid is foreign. However, Graves' disease, the bouts of hyperthyroidism, are for limited periods of time. And you may go for many years, 5 to 10 years, before you have another episode of Graves. So given that, while a particular Graves episode is temporary, Graves is forever. The second thing your naturopath may not have told you is that while natural solutions might work, they may take time to work, and there's no good studies showing that they work. While wonderful studies that have been conducted over the last 50 years show that antithyroidal medications not only lower the levels of thyroid in your blood, but they also make your immune system less likely to attack your thyroid. Of the 2 medications, the medication that does that more is methimazole, or as opposed to PTU, but both medications have been shown to moderate the immune system to some degree. So when you take a medication that's approved for hyperthyroidism, not only are you improving your thyroid function, but you're also lessening the ability of the immune system to attack the thyroid. Number 3 thing that your naturopath may not have told you is that while medications do have side effects, it's true that they have side effects, they have effects that are well documented, and the side effects are very few compared to the effects of the medication. And if you do have problems with the medication, there's 3 ways of treating Graves. There's antithyroidal medications, there's radioactive iodine, and there's surgery. So depending on your Graves and how it's progressing and whether you can tolerate medications or not, you and your physician could decide to go another path, another route to treat your hyperthyroidism. Number 4, the idea that you don't have to undergo surgery and that surgery is draconian. It's true, surgery is not the first thought, but in a good number of patients, between 15 and 25% of them have nodules in their thyroid while they have hyperthyroidism. While having too much thyroid in your blood actually does protect you from cancer in the short term, because your body makes, your pituitary makes less TSH, after you've gone through medications or have in other ways controlled your thyroid levels, if you have not evaluated to make sure that you don't have a nodule, that nodule can in fact be cancerous, and you might delay in that diagnosis if you did not get some imaging to see whether there is a nodular component to your Graves. Number 5 that your naturopath may not have told you is that while foods and exercise are always a wonderful adjunct, and I recommend them myself to my patients who have hyperthyroidism, they are not legitimate treatment for Graves. Why are they not legitimate treatments for Graves? Because foods and exercise cannot overcome an immune system that is gone off the rails and has decided to attack a part of the body. If that were the case, we would advise people with type 1 diabetes to have better exercise and diet, and that would cure their diabetes. Why it does not is because their immune system has killed cells that make insulin, beta cells that make insulin, and they will remain with diabetes whether they're healthy or not healthy. In the same way, a person with Graves cannot be simply treated with foods and not treated with a medication to stop the thyroid levels and be allowed to continue having too much thyroid in the blood, which weakens bones and muscles and which predisposes them to bad heart rhythms, because that is unethical. They really have to be treated with something that will lower the thyroid levels in their blood and lower it reliably and dose-related and in in a very well-reasoned fashion. Number 6 that the naturopath may tell you is that, it may not tell you, is that women are more likely to have Graves because of their tendency to have babies and their immune system to moderate itself when they have babies. So if you're pregnant, you have 50% genetic material that isn't yours in your body, your immune system changes somewhat for the pregnancy, and then after the pregnancy, it regains its strength, and when it regains its strength is often a time when women will develop Graves' symptoms and hyperthyroidism. Number 7, naturopath may not tell you that while radioactive iodine may not be the #1 treatment for Graves, for you particularly, it is an appropriate and legitimate treatment for Graves. Radiating your thyroid when you have so many symptoms that cannot be made better with medications, when you cannot tolerate medications, and you have too many side effects, is an appropriate treatment. In this country, 25% of people get antithyroidal medications, those pills, and 75% get radioactive iodine, with only a small percentage getting surgery. While in Europe and Asia, many more people get antithyroidals and very few get radioactive iodine. And this has been seen for years in endocrinology in this country. And I'm not quite sure why, because it would actually be to an endocrinologist's benefit to keep you as their patient for 2 years with antithyroidals than to give you radioactive iodine, which will solve the problem much more quickly. And hypothyroidism is mostly treated by primary care. It is not treated by endocrinology. So there's no real financial motive to do it, but I think that the willingness to try to get people treated quickly and get symptoms better can sometimes make it difficult to discuss the risks and benefits of thyroid medication, deal with some side effects if they do occur, and help people switch from one antithyroid to another if they can't tolerate the first. That's a little bit more nuanced, and maybe that's the reason why there's more radioactive iodine in this country, but I really do not know. The 8th thing that your naturopath may not tell you is that the economics of Graves are pretty important, because the symptoms are can be so significant. They can lead you to lose your work. They can lead you to be unable to take care of your children. They can lead you to even psychosis and change your life dramatically. So it's important for you to get treatment that will help right away and that will help you to get back on track very quickly, instead of waiting around to see if, low-dose naltrexone will fix your problems with thyroid, because you matter. You're very important to the people in your life who take care of you and who you take care of, and getting the correct treatment and getting quick resolution of your symptoms should be one of your main goals if you are ever diagnosed with this condition, or if one of your loved ones is diagnosed with this condition. Thank you for listening to this video, and if you really liked it, give it a thumbs up, and if you have any comments, please put them below, and if you'd like to subscribe, also subscribe below. Thanks.